Good morning. It's so nice to see you all again for it's kind of our second day, unless you were here Sunday, then it is our third day. My name is Patty Habeck, and I am the president and CEO of Feeding America Eastern Wisconsin. We cover the 35 counties on the eastern side of the state and partner with many of you in this room. So thank you again for coming out and for being in person. This is just really great. Before we get started with the panel, I do want to offer just a couple of thoughts, and one of which, yesterday we acknowledged the team that pulled this together, and the team was really great. But I want to do a special thank you to Stephanie Young-Dorfman. Stephanie has put in countless hours to get us together, and it was her vision that we were going to, by hook or by crook, we were all going to be together this year. And so I would just want to do a huge shout out to Stephanie for all the work she did to make this happen. The other thank you I want to do is, so often we don't get to acknowledge the folks that work behind the scenes or that don't like to be acknowledged, and so they try to stay behind the scenes. But even I could not be here today if it wasn't for our operations staff and our team that stayed behind. I know many of us have left people behind to keep our buildings running or our operations running while we were here. So I just want to do a quick shout out to all of those behind the scene folks that don't often get the shout out but truly deserve a lot of thank you. So just acknowledgement. Great. So we're going to get started with this panel. We have a great panel for you, and I really hope that you are ready with your questions, because we pulled together this panel particularly around collaboration and partnership and community, and how do we really work together with our resources to strengthen our communities. Before I was working with the food bank, I used to work actually in philanthropy, and I worked with high net worth individuals. It was about 15 years ago. I remember getting a call that to this day I remember it, just like yesterday. One of our communities that we were serving, a very small community, was having a rash of youth suicides. And these suicides had gotten to the point, there were so many, that the health department actually called it a suicide cluster, and they brought in experts to try to figure out what it was that we were going to do as a community to turn this around. It was getting pretty desperate. And I remember being in my office one day, and one of my high net worth donors called, and she was in tears. She had just heard about another suicide. She didn't know the family, and she didn't know the young person. But she called me and she said, "Patty, all I have is money, but I want to help." And I remember pausing and thinking, in some ways she's right. Money isn't going to change the fact that there are suicides in the community. Money can't do it alone. But the fact that she was calling me, that she was reaching out and she was saying, "I want to do something," and money is a really good tool, and it can be a good catalyst when it's used correctly. And so we got on the phone and we talked. We talked through all the different ways that she wanted to make a difference, all the different organizations that were working together to make a difference. We worked with experts and we talked about where an investment could make the biggest difference. And she did ultimately end up investing in that. She used her influence to get others to invest in that. And there really was a critical change that happened because she made that phone call to say, "I want to help." And she had the resources to start something. Money alone can't solve anything, but partnerships and collaboration can. And so when I put together this panel, I really wanted to talk about how we use our resources of a community in a different way to really start making the changes that we want to see in our community. Yesterday, Katie Martin talked about abundance theory, but she also talked about making something change from a transaction to a transformation. And my friends up here on stage are really transformational partners, and that's why I wanted to bring them together. The transformation that happens when all segments of community come together around an issue and say, "I want to use my resources to make a change." And whether that is from your perspective as a partner or an agency or whatever sector you represent, or whether it's from our friends up here who are working on the side of philanthropy or corporate support, when we all come together, we can attack that problem and really make changes. And so that's what today's panel is about, so get yourself ready to ask those questions. So let's get started. First, I want to ask that each of you have the opportunity to introduce yourself, talk a little bit about why you're in this space, and how you see food security as really an important part of strengthening communities. So Kevin, do you want to start?
Great. Good morning, everybody. Hope the conference is going well, and I'm excited to be here. just to talk from a health perspective on the role that food plays for our members. So I'm Kevin Moore. I'm the CEO of UnitedHealthcare Community Plan of Wisconsin. We serve almost 285,000 Wisconsin residents, either through our Medicaid Badger Care Plus plan, our SSI members, and then also individuals that are Medicaid and Medicare eligible through our dual special needs plans. So there's one criteria that all of them have in common, which is most of them, actually all of them, are eligible for Medicaid in some way, shape, or form, either from being categorically eligible, but most of them financially eligible for the program. And so by definition, they already have one of the barriers to a social determinant in terms of income that allows us to be their healthcare provider, or at least their health insurer. Reason why we're here, real easy. If you take a look at what drives positive health outcomes, and you read any information on social determinants of health or drivers of health or whatever you want to call it today, 80% of health outcomes comes outside the four walls of a clinic. So soak that in. You go to the doctor, that's 20% of your health. Your zip code, you probably heard these before, your zip code has more to do with your health outcomes than your genetic code. These are all things that for us as a partner to our members in trying to drive positive health outcomes, we can't ignore that anymore. It can't just be about a pharmacy getting a script filled. It can't just be going to a doctor's visit. We have to take a look at, wait a minute, where do you live? Are you housing insecure? Are you part of a family unit where interpersonal violence is a big driver? Do you have transportation? It's a huge issue. And then you wrap that all into one of the most basic elements is, what do we all have to do 2 to 3 to 4 to 5 times a day? You got to eat. And so if we're trying to figure out ways for somebody to get to the doctor, if we're trying to find ways for people to manage their own health care, and their priority list is, well, that's all great, Kevin. That's great that your care managers are calling me 5 times a day, but the refrigerator's empty. I don't care. My priorities are misaligned. And so for us, we have to figure out ways of pulling together our resources, our talent, our people, our treasure. And you're going to hear, I think you mentioned this, it's not even about the dollars sometimes. It's about collaboration. It's about convening. It's about getting people together that may never, we were just talking about it, we never met before, but now all of a sudden we're looking at each other going, okay, now there's a different opportunity here because now we can bring something different to the table, either geographically, financially, people, or just knowledge base. So for us at UnitedHealthcare, it's an incredibly important part for us to get to the next level of having our members be healthier and allowing them to meet their individual and family goals.
Good morning, everyone. I hope you all enjoyed your breakfast. I'm Kalyani Grasso, and I'm with the Siebert Lutheran Foundation. And this is a Milwaukee-based private foundation founded in the 1950s by Albert Siebert. I am a program officer, so what that means is I have a portfolio of grants. We have, my funding area is in, it's called Serving as the Hands and Feet of Christ. And we work with about 40 food pantries within that area. And support up to about $1.4 million in grant funding to these, to actually all entities within that funding area. So why am I here? Let's see. Mr. Siebert, the guy who founded my foundation, he is, you may know him because he also created the Milwaukee Tool Company. And he had a passion for making sure that people were not hungry. And so we invest heavily in food security. We, ultimately, our hope is, one, that the programs that we support build pathways to stability. So what does that mean? That means that if we're supporting a food pantry, we're hoping that the pantry can go a little bit further than providing food, so that if someone comes to the pantry, they can get referrals to other resources, possibly in the area of housing, health and wellness, addiction counseling. The list could go on, but essentially other resources that go beyond food. We hope, second, we hope that the entities that we support are building community. This is really important. We've realized that a lot of people who come to food pantries are looking for community. Oftentimes, it's not just the bag of food or that they walk home with or drive home with. It's more than that. And so our work is really, a lot of it is building connections across organizations, within organizations, building community within specific geographic areas, and strengthening those areas. And finally, our hope is that the programs that we support empower people and help them to grow as leaders and become more active in their community, their voices become heard, and then they can begin to break down those barriers to stability. That's about all I have, really.
Good morning, everyone. I'm Greg Vandenberg. I'm with US Venture. Most of you probably don't know the name of that company. We are headquartered. Oh, sorry about that. You missed what I said. It was brilliant. So we're headquartered in Appleton, Wisconsin, up in northeast Wisconsin, and quite a large company. We'll be about the third or fourth largest privately held company in Wisconsin. We work in the energy and automotive industry, and the company was founded by three Schmidt brothers in Combine Locks, Wisconsin 70 years ago. And the company has grown immensely. We now have a national footprint. But from the start of those very early, humble beginnings, the family has always really felt like they need to give back to the communities that have been good to them. It's a moral imperative that who's been given much, much is required. And so I always like to say we were doing social investment way before it was a business strategy or something cool to do or a fad. And it has been an incredible legacy, and I consider it a privilege to be able to build on that. One of the areas that we are most known for is we host an event called the US Venture Open up in our region. And to the best of our knowledge, it's the largest one-day philanthropic event that raises money to end poverty. And so Patty's attended a number of times, and we raise a lot of money, it's a lot of fun, but really the important part of it is we've really driven collaboration between the funders. So we have over 500 funders and partners at the table, a lot of local foundations, corporate foundations, a lot of different companies that we work with, vendors and customers. And as we have tried to collaborate from a funding standpoint, we have tried to model that for nonprofits. And so the dollars that come out of that event, which last year was $4.2 million, we grant that out to nonprofits who are also collaborating and who are innovative in the space to end poverty. And Patty and her group have been some of the greatest collaborators in our region. We love working with them, but we really believe that poverty is an incredibly complex issue, and that not only, we've also learned that not only, must just be my voice. We also believe that we need to move beyond collaboration. And a lot of this we've learned from Patty and her work is we need to start looking at systems level change and how can we use that collective voice of funders, which has a lot of influence. And it's not just about the money we raise. We have influence at the state level. So how do we advocate to change the childcare system? How do we advocate to change the food system? And coming alongside partners. And it really is about partnership. And so we're on that journey of learning along with everyone else, and it's a privilege to be here.
Great, thank you. I'm kind of nervous to use the microphone now. I think it's going to be like Greg is super powerful and his voice is like echoing. One of the things I like most about working with each of the people that are up here today is that the needs that I have are also so much beyond money. When I have an opportunity, as a big organization, when I have an opportunity to really invest into a community, I know that I cannot do it alone. And I know that each of you, as you're serving your communities, absolutely need the help of others. And large funders and large investors and corporate community can play such a huge role. So now my question to you, and Kalyani, I think I'm going to start with you on this one, is, and I'm trying not to go off script because I gave you a little heads up, but I'm going to go off script because that's what I do. Really, what does it look like for you to really work in a community where you're building up, where everyone's voice is heard? We know that historically, not everyone's voice has been heard, and it's been our goal to really make sure that everyone's at the table, because then we understand the entirety of the issue, and we can start understanding what we need to address it. So, Kalyani, like, what is some of the work that you do, and your belief in making sure that we're able to get the voices heard at the table?
That's a great question. I'm going to start by saying that it's really important to have the clients, the guests that you serve, represented at the table. Oftentimes we just forget, and we're so busy organizationally that we forget who it is who's actually going to ultimately benefit from or not from the work that you do. And so that's one. Two, I'd say definitely bring in community partners. It's amazing how much you can learn by inviting people who work in maybe different fields, and whether it's in education, healthcare, addiction counseling, housing, for-profit, the corporations that provide job placement or training, or that can help maybe create a pipeline within your community. We just are as a foundation, very, very, very eager to partner. We love to partner. And we've really seen a lot of results in partnering with schools, with other foundations, with, just making sure that whatever we do, and it's not just about the money, it goes so much further. $300,000 to one school, if it's a joint funding, we just had a joint funding partnership to provide counseling to students. Actually, it's a 365-degree, 365, okay, my geometry is maybe a bit off this morning, but it provides wraparound care to families who have their children in that school. And so those kids can actually, their parents can come to a particular person and get assistance in a number of different areas, whether it's looking for a job, finding daycare for younger kids, or perhaps finding stable housing. And so this kind of wraparound service within one school, it has very far-reaching impact, way beyond the $300,000 that was invested by two foundations into that pilot project. And hopefully this can be replicated, so the successes can be documented and then perhaps replicated in other schools in the area. And so together, I think that a lot of the problems are systemic. We can't do this alone. We have to come together. Our voices have to, together we can be a lot louder. And I think that, even the three of us, if we had a chat, I'm sure we could find some area of commonality where we could work together. And I know that during the pandemic, we did come together a lot more. Somehow Zoom, as annoying as it is, allows for many meetings. And so we would have, I know that Feeding America was part of it, but we had what was called a civic work group, which was hosted by a local foundation, which brought together over 40 entities in the Milwaukee area. And we talked about what it is that we want our mayor and governor to invest in terms of food security. Where do we want the pandemic relief funds to go into? And so our voices were heard. We came together and our voices were heard. So, it doesn't have to be a big thing. Sometimes very small things at a food pantry level can also be heard. It does not have to be a gigantic, huge effort. I think small things can also make big change.
Thank you. And Kevin, I'm going to ask you a very similar question because you're coming at it from a little bit of a different angle. How do you make sure that when you're making decisions, you hear the voices that are around you and you're really lifting up and engaging the voices from community?
Yeah, at the end of the day, I think for a corporation, I was kind of laughing. You all started with brothers and brothers, and I'm sure somebody at United was a brother at one point, but that was a long time ago. It's about being able to bring people to the table, a diverse group of people to the table. It's the ability to make sure that all voices are heard, whether it be a corporation, whether it be philanthropy, but primarily the people that are on the front lines, either from a CBO, a community-based organization, or even better yet, making sure that a client, a member, a patient, they're all the same person, right? So how do you start to have that translation so everybody is speaking the same language so that everybody has a clear vision of what the goal is? Then there's the big dose of humility. Then there's a big dose of UnitedHealthcare needs to be able to come to the table and understand the problem is the problem at the local level. We have a couple of different roles, though, that we can play. We can amplify. So that's where money and people and power, that's where we can take a good idea and amplify it. We can advocate. We can join partners, whether it be talking to legislators, whether it be talking to county boards, whoever it might be, to say this is the way we want to go. But probably the area that I think is most important is we can find ways, and so at 1 + 1 then gets to the big issue, which is sustainability and scalability, which is, while Appleton is going to be different than Milwaukee, which is going to be different, how do we find commonality so when we're advocating for policy change, or we're advocating for something where we want to look at the way we do benefits differently for UnitedHealthcare, and we have done this. One of the best benefits we have for our dual special needs members is not our clinical model, it's not our pharmacy, it's not anything. It's the fact that they have a over-the-counter food card that they get $150 a month to be able to spend the way they want. So there's a double whammy there. It's I have choice, I have agency over my own dollars, and I'm getting the money to pay for things that are important to me. So you add all of that, and that I wish there was probably somebody within United that was the brainchild of that, but at the reality, it came from our members giving feedback to us. It came from the community saying, look, we have even something as simple as, we know that housing is a big issue, but if we take $150 worth of food costs off the table, it opens up individual budgets for other areas. So there's little things that we can do. And then for us, the advocacy goes a couple of different ways. It's educating down. It's saying, look, this is what we're doing. Are we doing it right? And then it's going to our state partners. It's going to the federal government and saying, look, we now are starting to see some positive outcomes. We're starting to see, whether it be health outcomes improving, we're starting to see engagement in healthcare improving. And I'm not even getting into the biggest issue, which is we're starting to see equity starting to improve as well, which is we're starting to see, whether it be rural, urban, whether it be Black, Latino, whether it be LGBTQ, whatever population we're looking at, how do we start to realize that the investments, the collaboration, the listening is being amplified into positive outcomes? So I say all of that, which is it's all predicated off of, you got to come to the table, you got to ditch the business card, you got to realize, you got to listen to what's going on locally, boots on the ground, and from that then you find out where you find the commonality. And then everything else, it's so easy, right? Everybody's going to leave here and it's going to be, we're done, right? Like we're going to have one panel and everybody's going to have this done. But if you can't start there, you're never going to get to alignment. You're going to pull left, you're going to pull center, I'm going to pull right, and the member, the client, the patient is sitting there going, huh? Which now is the exact opposite of what we want. We want them to be in charge, I love what you said, empowered in their own community, right? So a lot to unpack there, but at the end of the day, it comes down to humility.
I love that, and to Greg, I'm going to actually carry that just a little bit farther, because I know one of the things that I really appreciate when I'm working in community is I'm carrying the voices of my network. So I'm carrying the voices of the pantries, I'm carrying the voices of community, the stories of the neighbors that I just met at the pantries, and I need to lift that up somehow to have it be heard at the corporate level or at the philanthropy level. And so when I have information, I don't want to hold it, I want to share it. And so very often I would reach out, for example, to Greg and say, Greg, here's what's going on right now, and if this policy change doesn't go through, this is the impact that's going to have in our communities. This is what it looks like. That's information I have that might not be Greg's only focus, because I'm looking at something very specific and Greg's looking at something larger and universal. So Greg, how do you like to engage with, I mean, we have everybody in the audience here, our pantries, our community, they're representing their community in some way, and they have information that you need as a funder. How do you like to engage with community and make that a transformational rather than a transactional?
Yeah, I think it does come down to relationship, and so for us, in our area of Northeast Wisconsin where we're headquartered, it's a real mix of I dare call it an urban area, but also a lot of rural pockets. And so I'm preaching to the choir to say we have food deserts both in the urban space and in the rural space. And I think from a business standpoint, corporations tend to design in the boardroom and then implement. And the reality is that can work in business, but it has failed over and over again in trying to help those who are in poverty or who are hungry. And the reality is we not only need those voices at the table, but we have to give up power so that there is safety for people to be at the table. And I think that starts with nonprofit leaders like yourselves, those who are working with clients like yourselves, and the clients themselves. And the reality is that when I think of decision-making at a board level, whether it's foundations, traditional philanthropy, typically everybody around the table looks like me. And that is not, one, a great diversity or equity focus, also just not a great diversity and equity of thinking and decision-making. But third, one of the things that we've really invested in is some solutions that are born out of people who are in the situation. And so I think I would love to hear from you, and that can be in any way, phone, text, through your websites, whatever. But to be able to hear what the solutions are for your community, because I think too often we're just trying to split things down the middle in how we approach it. And the reality is we need to be at the micro community level and really engaged. And we need to talk about systems level and advocacy and some of those types of things. Because the systems are broken, or as Deming would say, the system is perfectly designed for the results it's currently getting. And I think it's a both and I think we in philanthropy are on that learning curve of how do we invite people at the table when, quite honestly, some funders love the influence and power that they have by being able to be that decision maker. And so I would welcome you to share with us what solutions are you hearing from clients, from your local school districts, from your community. Check out an organization called Live Algoma. We have funded them for a number of years. They have transformed a very rural and I would say tourist economy-driven community. A lot of opioid usage, just poor health outcomes. And they have become now a model city and have won a Robert Wood Johnson Foundation Award. And they've really done it by going to the community and saying, what are the solutions that you see? So kids are at the table, not as a token youth representative, but they are there developing ideas. And we're investing in them to try to spread and scale that. Going to people who are elderly in the community and saying, we know you feel isolated. How can we help come alongside you to make sure that you stay in community? And so those are some of the ways that that we've tried to approach it. Like I said, we don't have it all together. We're still on a huge learning curve, but we want your voice and we need the solutions rather than them coming top down.
Yeah, thank you. Couldn't agree more. And I think one of the things that we have to do as nonprofits is really understand that the information that you hold is so incredibly valuable to the people that are here and to the funders and other community resource holders, that we need to make sure that what you have is considered valuable and that you're sharing it so that the funders know what the issues are, what the ground level issues are, and how they can help invest in that change. So let me switch it up a little bit and ask you a question around one of the things that I always struggle with is I have the problem of the here and now. And since I work in food, my here and now is this. I need food. I need food to be able to provide. This reminds me of Katie Martin's talk yesterday. I need food to be able to share with the pantries so the pantries can get it out to the neighbors in need. But I also need to invest in that systemic change. I need to be able to have the ability to stop, slow down, and invest into that solve space, into how are we going to make those investments and those changes that Katie also mentioned yesterday. So let me ask you how you, as from each of your either foundations or your corporation, how do you look at the needs of both the here and now, what's needed today, and investing in what changes we need to make in the future? And I'll start with you.
Start with me. This is, boy, that's the question, isn't it? The challenge is that it's a difference between looking at a larger strategic goal or an objective and what we as humans, I think, are programmed to be, which is very tactical. We like to see somebody come to our door and be able to know that we helped you with an issue, or we've provided you with food today, or we've helped you with housing and security, whatever that issue may be. So we like that. That gives us that rush of I'm helping today. The challenge is when you talk about system change, when you talk about things like data. I fall asleep, and my team is sitting here laughing at me because they talk to me about data all the time. The reality, though, is data is the new pipeline. Data is the new infrastructure. Data is the new water system. It's the electricity system. It is the thing that we all need to start to think about in a different way. And you know what? It's not sexy. It's not sexy to talk about things like, I'm going to screen people for social determinants of health. I'm going to ask uncomfortable questions about housing insecurity to maybe a mother that's really nervous about asking that question, because if she answers it wrong, is CPS going to come and take my kids? There's a training mechanism, but you know what? The data is important. We need to look at data from a race perspective. We need to look at data to be able to understand how to know how to communicate and how to talk to people. When you start, now I'm getting all revved up on it, but the challenge is nobody wants to talk about that because the benefit, the payoff on that isn't tomorrow. The payoff isn't the fact that I'm going to be able to deliver a grocery. Like, I love the fact that we pay for groceries through Amazon for people and it gets delivered to their home. I love that. What I don't love is I don't know how many of my 280,000 members actually needs groceries. I need that data to be able to know if I can go back collectively to our state partners or our national partners and say 32%, now don't quote me on that, I'm picking that out of the clear air, but 32% of the people in the Dells area we know are food insecure, and we know based off of demographic, based off of census tract, we know that there's a food desert there, we know how big of a food desert it is. Wouldn't that be cool? But guess what you need? You need to pull people together. You need that sense of humility to say, my data needs and your data needs, let's find where that overlap looks like, because that's how you get the momentum for systemic change. That's where all of a sudden, now it's not advocacy. Now it's read the data and it's duh. It's do we want to solve this food desert? Do we want to actually improve food outcomes? And so the challenge, I think, is we have to get amped up on stuff like that. We need to get excited about systems change. We need to be willing to sit at the table and have some very abstract conversations. But by doing that, I think we can find out from a community perspective. So I'm kind of juxtaposing humility here with the ability to think about abstract. We need to be able to sit down and say, look, and I've said this before, I'll say it again. I have no benefit of trying to differentiate social determinants of health data from my competitors. I get no upside to that. You know, going and saying I have better social determinants of data than, I'm trying to think who else is sponsoring here, not to call them out, but than Anthem does. Because at the end of the day, it's the same community. It's the same infrastructure. It's the same fabric. It's the same CBO providing food. So we have to kind of, at a corporate level, we need to kind of disengage and say, okay, we're gonna be amplifiers. That void, though, needs to be filled by people in this room. We need to have that conversation about how are we going to collect data? How do we collect data across all the different systems? Democratize it. And it goes both ways, because I want that data for my reasons. I also want to push that data. I want that information to be available at a food bank to say, you know what, you don't need to screen Kevin for food insecurity because somebody at my table here, one of my team members, did it yesterday. Because guess what? If you do it again, guess what you've done? You've eroded trust. They're like, aren't you guys talking to each other? Because guess what? The other part, Amazon knows what I'm thinking before I even think it. So all of this money going into this system, why can't you guys figure this out? And part of it, we need to step back. We need to collaborate, and we need to do the systems change. But we have to take that stop and say, look, you know what? I really want to provide that food basket. We're going to continue to do that. We have to. But I'm also going to start dedicating my time to this larger systemic change.
Kalyani, same question to you. From a private foundation, how do you really tackle that problem?
I get really excited about data too. Even if it's a morning, 8 a.m. in the morning, it's powerful stuff. But so I'm just going to go back a little. I worked at a food pantry, and it was one of the busiest food pantries in a tri-county area. It felt like we were on a hamster wheel. It was really hard to stop and think about systemic change or, long-term. It was really about the present need. But then I read Katie Martin's book, and I realized recently, I was able to put it into words, that this is not an emergency. This is a chronic condition. This is not, it's not just, plugging a hole constantly. But, quite honestly, from a pantry level, it's really hard to see that when you're busy day in and day out. Now, as a community investor, I'm working at a foundation where there is a tussle between supporting basic urgent needs versus supporting long-term change, looking at, what can we do that will make a difference forever, for, not just today and tomorrow. And, Siebert likes to invest in both. The foundation invests in both tangible resources as well as in systemic long-term change that requires investment over many years. That kind of investment is possible for a foundation. It is the kind of investment that actually moves the needle. It reaches the root causes of problems that sometimes, requires a level of patience and requires just sitting still, not waiting for a result in 1 year or 2 years, but just sitting and waiting and putting the thought, the data, the collaboration into making something, something that, we can say 5 years from now, we can look back and say, wow, that diet, promoting a nutritious diet in that particular neighborhood really has an impact in terms of diet-related illnesses. You can see that. At some point, we will see those results. It may not happen in one day, but it will happen. And when that happens, families will no longer be dependent on a food pantry. So that is really the end goal. We don't want people to have to be dependent on coming to a food pantry. We would like grocery stores, walkable grocery stores that provide affordable, nutritious food. And that could take time, that could take concerted effort within a community to make that happen. But as a community investor, we would love to see that. And we would love to partner with anyone who wants to partner with us in that area to make long-term systemic changes that address root causes of hunger.
Greg, anything to add?
I would just say that I think we have learned a lot in trying to do both. And so we really kind of have two swim lanes where we do our funding. One is through our private corporate family foundation, and then also I mentioned the U.S. Venture Open and the outing. And the dollars raised at the Open have been to get to the root causes of poverty. So how can we have organizations collaborate? But I think we've learned over the course of 13 years that there is still immediate need, and it's chronic. And I think we saw a sucker's choice of you got to pick one or the other, and it really is a both and. And I'm excited about organizations working together. Patty works with some great organizations that we've helped co-fund along with Feeding America, Fork Farms, Riverview Gardens. There's this interconnectivity that happens around incarcerated men coming out of jail, and now they need workforce development, and they need to learn soft skills. Well, how can we leverage that in a garden to be able to grow fresh produce that now we can either sell to our local grocery stores or we can give to a Feeding America to distribute. Again, the Fork Farms model of, kids need to learn that and love fresh tasting food. You can put it in front of them. I put it in front of my kids all day long when they were young. They didn't eat it. But maybe if they get their hands in the dirt, or maybe if they're in charge of the growing machine and there's a curriculum involved, now they own it, and it's something that really changes the course. But I think we have learned I'm proud that we tried to make that switch, because I don't think at that time it was popular to say, let's get upstream and fund things that aren't what's considered emergency needs. And I think we've pulled back on that or learned from that to say it's a both and.
That's great, thank you. One of the words that I learned along the way was the word coopetition, and it was actually founded in the automotive industry, and it was about what can we invest in, even as competitors? What is something that we both need that we can invest in together, and then we can take it at some point and personalize it again. But that coopetition, and what that means is really about working together with everybody, including those that you might see as, and in our space we don't like to use this, and then we don't really use this, but as competitors. But what can we learn from each other, and how can we really help each other advance? Because it's about the good of our community. So I want to switch a little bit and let the audience ask you some questions. So I hope you're ready for this. And I hope you've been thinking about your questions. And I know Jordan is somewhere out there ready to take your questions. So if you just raise your hand and let us know what you want to hear from our panelists. Yeah, absolutely.
Hi, I'm Jennifer Larson. I work with the AmeriCorps Farm to School program at a elementary school, or at a Montessori school in Madison. I guess my question for you guys is, what initiatives have you guys taken with the youth in terms of fostering food security? I know you just spoke of a garden. All of us at that table do a lot of that, and with children. And I'm sorry, you mentioned also a school that had kind of changed approach that way too. So just curious if you can add more to that.
Sure. So we have, I'm not sure how many of you are familiar with Fork Farms, but I was introduced to them through Patty and the partnership they have with Feeding America. And they are now a thriving company that is really creating fresh food in indoor hydroponics. And so it's an indoor growing machine. And so now you can buy this machine for like $1,300, and I can put it in a school where there's a food desert. And there's a curriculum attached to it. So now the kids are learning about horticulture and agriculture, but there also is that experiential learning piece, which is so critical, and so many kids in poverty don't get experiential learning. They don't have those experiences. And so we have been excited about that partnership because there's two things. One, it's really difficult to get fresh food into the rural communities without just saying, let's do another transit van, let's do another transit van. Where this is something that can be in the community, they own it, it's really cheap to keep it going, and you're harvesting fresh food on an ongoing basis. And this can do anything from lettuce to herbs to all kinds of different things. And it's interesting because it's obviously sort of this technological approach, but it is really at the micro local level when you can have this in a school and you can use that in your cafeteria and you can use it in your curriculum. And we have invested in that in some of the rural and urban food deserts and have seen some really exciting results. And I know Milwaukee, they're testing that also in one of the neighborhoods. But it's a really neat model because you actually can create some sustaining revenue by selling the product to a restaurant or the cafeteria in the school. But to have that engagement with the youth, then it starts them on a path where now I want that food. It's not just that I can't get it. If we can provide it, now they'll want to eat it.
If I can add to what you just said, we have a number of programs that are based in urban areas in Milwaukee that have schools involved in urban farms that are in the area, and that has just been fabulous to see. It's amazing to see these youth, and it's a formalized internship program where they learn leadership skills, they learn about the agribusiness, they learn about the fact that they live in a food desert. One area, I don't know if you're familiar with the Sherman Park area, you have to walk 30 blocks to get to a grocery store. It's ridiculous. I mean, you can buy a bag of potato chips, but you cannot buy a tomato. And so these youth are, they're bringing home vegetables. And this one young man, he was so excited, he said, my grandma and I talk about growing vegetables all the time, and she grows it in her backyard, and this young man is helping her because now he understands. And he has gain this appreciation for food. It is a different context than listening to it in a classroom when you actually grow your own food. And so we found that a number of churches in Milwaukee have taken that on, and they've taken empty parking lots and they have raised beds where they're growing vegetables with the youth in the area. So it's pretty exciting. I love that area.
We've done the hydroponic, we've sponsored those. I also think it's about finding out from an advocacy perspective, what are some of the macro policy initiatives. I think a lot of things have changed via COVID. We've realized, I think early on, it was when the schools closed down and all of a sudden people started to scratch their head going, wait a minute, now the kids aren't getting breakfast and they're not getting lunch. I think how do we learn from those lessons, either to do one of two things. I don't want to say if or when, but there could be another pandemic. I don't want to say that. I know, sorry. But if we're not prepared for it, it's kind of on us, right? So how do we start to think about those policy levers that were maybe emergency now, but maybe they should be best practices? And again, from our perspective, how can we amplify those messages so that when we know that there's kids, because again, for us, it's mom and dad and kid generally, how can we then magnify whatever that policy lever is so that they're actually maximizing whatever that is? So yes to everything here from like that tactical level, but then what are those systemic changes that we need to really advocate for based off of, we had 2 years of forced learnings, right? Let's not lose sight of what worked, and then also let's not lose sight of what we learned, so.
And I'm just going to add on that from the food bank perspective too. When we have youth volunteers in, it's really interesting to me. I love to walk out when we have the volunteers that are the youth, because quite honestly, they have amazing solutions, and they are not bounded by the things that we've already kind of tempered ourselves with. And so when you go out there and you ask them the questions, what would you do to change this? How would you do this differently? What are some technologies that you're seeing? And honestly, one of the most interesting things I've ever seen was I was meeting with a group of parents and their children, and the parents are asking me about the statistics related to school poverty and going, wow, that's just amazing. And the kids are sitting there like, yeah, I say this every day, Mom. Like, the kids know it, and the kids see it, and the kids have solutions. And so it's really, how do we harness that? And especially those young people that are hungry with ideas and imagination and energy, and how do we capture that and really apply that? And so I would say, when you have those opportunities to really engage with the youth population, ask them those questions. What would you do to solve hunger? What would you do to just name a specific problem? And you're going to hear solutions that we don't always come up with because we have so many other things in our head, and we've already kind of tempered ourselves in ways that the youth don't do that. So I love your question. Other questions?
Hi, my name is Mallory, and I'm from a food pantry in Fond du Lac, Wisconsin. And Kalyani, I like what you said about, I feel like we are the hamster on the wheel. We want to do systemic changes. We want to make the whole life better. But I got 45 cars in the parking lot that need a box of food right now, and so we need to be sourcing food. We need to figure out who's going to sort that food, who's going to go pick up that donation. How are we going to get fresh greens in here before 11 o'clock this morning? I feel like, while at this conference I've learned quite a bit, this is my first year here, I feel like I'm happy to share any information I have, any of my knowledge, I'm happy to give to you. I need better coming back from you telling me how I can change something, because it feels like for my group, we're so busy just trying to make it so that that person has some food today, or that kid has a backpack for the weekend, or that homeless person has a box that has everything popped top and fork and spoon inside the box. So, and we've thrown money at different things, some of it successful, some of it not. There needs to be a little bit more for me, a little bit more for coming on top. What you want to see. We'll try anything. Tell me what you want, and if you'll pay for it, and we'll try it.
I think you hit the nail on the head with, will you pay for it? So I see my role as really, again, learning from you, And how do I educate the people that make the decisions around grant dollars? And that's a process. You know, we're really trying to move towards trust-based philanthropy, where how do we engage with a Feeding America or a food pantry like yourselves, where we're not making you run the gauntlet to get $5,000 every year. We are giving you dollars to invest in the work that you're doing. You should be professionals at trying to feed people. You shouldn't have to be a professional fundraiser. And that's on us as funders to learn. And I also think in connection with that is we need to put money into things, as you mentioned, like data, but also in things like capacity for organizations to have a little bit of margin to be able to do strategic planning. How could we look at wraparound services, you know, seeing the food pantries as not just a point of entry, but a place where services beyond food can be provided. But I fully realize you don't have the capacity to do that. So we have to start funding some different things that give some margin to organizations like yourselves to be able to invest in some of that space and being able to come to a conference like this instead of being on the hamster wheel and things like that. And I'll be the first one to say, as a funder, there's a lot of funders out there that are just not in that headspace. They are looking at what's your administrative overhead and all those things. And again, everyone needs to be fiscally responsible, but to be honest, you're held at a much higher level in the corporate world when it comes to all those things. And we need to change that model, and we need to build capacity so that you can do exactly what you're talking about. And I'm going to keep working every day to try and do that in my space.
I think you hit the nail on the head in terms of funders needing to recognize that without building capacity, we can't really invest, we can't say we're investing in change. And so, you know, that's one aspect. Another one, just from a very practical perspective, I think is sharing information, documenting successes, and learning from other pantries that are in the area. You know, I know that there's not much time, but one of my mentors once told me, you know, I asked her, like, when do you have time to think about grand ideas? And she said that she actually puts aside about an hour every Friday afternoon to this, just kind of do an internal brainstorm or brainstorm with her team. And, you know, it's a luxury, but I think that it's a luxury that could have dividends in the long run.
I want to acknowledge that what you said and how you said it and the energy that you had behind that is so true and so where we are right now, which is I just need help right now with today's issues. That getting food, having the food you need because you're the one that's looking into the eyes of all those neighbors in need, and you need to have an answer for them in the form of today, in the form of food. And I think that's where all of us come together, and that's where this network is so important, is we need that voice. We need what you just said and all the heads that nodded when you were saying it, and I felt like I should jump on my chair and do that Jerry Maguire moment of, yeah. We do need the today, the here and now, because when we can handle that issue, then we can get all that stress down the level and then be able to look at tomorrow's issues, and it is a balance. But we can't forget that we have to look at tomorrow's issues or it's just going to keep expanding. And so that balance is really critical, and your voice was heard on that, and I know it's something that I know each of the panelists pretty well, and I know it's something that we talk about. How do we make that balance? How do we make those investments? It's scary to make an investment in the future knowing that there's a today issue too. And so just thank you for saying that out loud, because I know that hamster wheel is real. We are actually out of time, and I just wanted 1 minute to let any of our panelists have any final thoughts that you want to share with the group. But my final thought to you is, please do not think of funders as sitting somewhere outside of the problem and that you need to wow, woo, or cajole them into understanding what your issue is. Think of the funding community, the corporate community around you that funds you, as your partners. And how do we make sure that you are sharing their information with them so that they can turn around and understand what your needs are? That was my last statement. Anything from you?
Yep. So I'm going to give everybody homework. I'm going to go completely off of everything. I need your help. we are going to understand. So my contact information is in the app. You know how to get a hold of me. If not, talk to her. She knows how to get a hold of me. Got it. Here's the issue that's coming up very quickly. It's going to impact everybody in this room and anybody that has direct contact with anybody that's in Medicaid. The state of Wisconsin is going to be undertaking a massive redetermination process for Medicaid. It's never been done at this scale. It's all tied to the end of the public health emergency. So I have one favor to ask everybody in the room. Go back and put in your browser access.wi.gov. And any member, client, anybody that walks into your room and ask them, have you been to that website yet? And if they say no, give them that link, give them a QR code. And the reason being is we have not done redetermination for Medicaid in over 2 years. There are some people that have not been redetermined for 3 years. Now, I'm in a room full of people that do food. Wisconsin's an integrated eligibility system. So it not only does Medicaid, it also does SNAP at the same time as well. So making sure that email addresses, phone numbers, mailing addresses, all of that information is accurate is going to do two things. A, it's going to help them on their SNAP eligibility, which hopefully they've been keeping up, but some people fall off. And two, it's going to make sure that people that are eligible for Medicaid stay on Medicaid. And so if we're looking at that kind of that 1-2 punch of social determinants and access to food countered with access to affordable health care, it's the single thing you can do, and forget about me working for United, this is a systemic thing for us as Wisconsin residents. Access.wi.gov. Anybody, channel them there. They can update all of their information online. And that's my homework for everybody. I'll be calling everybody individually to make sure that it's in your browser afterwards. But I just appreciate you indulging me because it will wash up on your shores. You will have people that are going to come in saying, I lost my Medicaid eligibility. Let's get ahead of this now. Let's make sure it's not because my email address had .gov versus .com. Let's fix it now while we can. So I took more than a minute, but there's my public service announcement.
Yeah, I feel like I've said everything. I just wanted to end on a positive note with a quote from one of my favorite authors. Her name is Arundhati Roy, and she says, "Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing."
And I'll just end with appreciation for every single one of you. I hope this time allows you to breathe a little bit. I know you guys are on the hamster wheel every day. I know you look people in the eye every day, and there is, they talk about secondary trauma. They talk about turnover in nonprofits and the work that you do. And so know that you're heard and, appreciated because you are the social safety net for so many of our communities, so many of our families and our kids. And so thank you so much for your work, and we look forward to learning from you and being able to fund differently and partner differently so that hopefully we can get all of you off the hamster wheel so that you can have some time to breathe, have some time to dream, and go from there.